Women's Health Wednesday now. August is National Eye Exam Month in the U.S., and the goal is to raise awareness about the importance of regular eye exams. It's a great time to prioritize eye health, which is often neglected, even for those at high risk for vision loss. And health experts say women are more prone to certain eye problems, eye diseases, than men. Joining us now is Dr. Yika Zobel-Ratner, a pediatric ophthalmologist, and Laura Zeliger, CEO and Executive Director of the Northeastern Association of the Blind at Albany. Dr. Laura, thank you both for being here.
Thank you for having us.
Of course. Doctor, let's start first with why people tend to neglect their eye health. Is it because, you don't realize it's important? I mean, some of the symptoms can be silent. Is that fair to say?
Yes, I think that's correct. I don't think they so much neglect it as if everything's going well, they just don't think about getting an eye examination.
Yeah.
And they've received eye examination as children. From birth through the teen years, they've been checked regularly.
Right.
And then when we reach our adulthood, we tend not to always get regular eye examinations, which should be done once in your 20s, once or twice in your 30s, excuse me, and then in your 40s, you should get that yearly.
Okay.
Because
we can get you
again,
some water too. We'll have somebody get you some water, but you're doing great. So that was my question. So yes, you get those regular checkups, but then things change when you get older. So that's a good guide for everybody to know.
Yes.
That's helpful. Let's talk about women in particular here and why they're more prone to certain eye diseases.
So women will have hormonal fluctuations. Pregnancy is a biggie. A lot of things can happen. Most of them will reverse once the baby is delivered, but some of them can be permanent, so hormonal fluctuations. Women tend to live longer, so we have a longer time to accumulate these diseases and the outcomes of them.
We have the information we can put on the screen for everybody too about the risk factors.
Eye makeup. Women tend to use eye makeup more than gentlemen, and
there you go. Keep on going. We're going to get you some water there.
Thank you.
And so cosmetics are a concern.
Cosmetics, yes. So cosmetics can lead to dry eye or infections. Never ever share your cosmetics, not with your bestie, even if it's your twin. Never share your eye makeup.
Good advice. All right, Laura, let's bring you in here to the conversation because your organization does some really important work here. Tell us about some of the services to help those who are having problems.
Sure. So Northeastern Association of the Blind provides services to people who are legally blind or low vision or vision impaired. And that can be as simple as providing, if it's a low vision loss, some magnification devices or other tools to help someone see better, CCTVs. If, however, someone's reached the point where they are blind or really unable to navigate, we have trained staff who can teach people what we call orientation and mobility, so they can travel safely, so they can live independently in their homes, how to cook, how to take care of their houses, how to help people get jobs.
So important because it can be very isolating, but obviously if you have those supports and you know what to do, you can be independent.
Very much so. That's our mission, is helping people maintain or achieve that independence.
Fantastic. One last question, doctor, for you. Is there anything that we can do, before we get into problems? What can we do to just protect our eye health?
So number one is know your family history. So if you, and your own history, of course. So if you have a family history of glaucoma or macular degeneration, you should get regular eye examinations. I already outlined them, but definitely don't skip those because in the early stages, they're generally asymptomatic, and that is when they're the most treatable. So know that. A very simple thing, wear sunglasses when you're outdoors, and not just dark lenses. Make sure they have that little sticker or tag that says UVA and UVB. If they don't have it, don't wear it. You may be causing more harm to do that. Protect your eyes. So protect them at work, during your hobbies, and if you have a construction job or work with chemicals, there will be specific goggles, eye protection to wear.
Right.
When you're weed whacking, very big one this summer, make sure you protect your eyes.
Interesting.
And if you work at a desk, you won't harm your eyes by looking at the screens, but you'll become uncomfortable. So a simple rule is the 20-20-20 rule, which means every 20 minutes, look 20 feet away for 20 seconds. Just give those eyes a break. Give those little muscles a break and you'll feel much better. I already mentioned, never share cosmetics.
Yes.
Always have general good health, so eat well, exercise, stop smoking if you smoke, are all very, very important.
Great information. Thank you, Doctor, so much for coming in, and Laura, for being here. The services
Yes.
that are available for people who are struggling, because you want them to be as independent as they can for
Yes.
as long as possible.
As well, and if I have
Yes.
1 second, I also say NABA does vision screening for preschoolers and young children who are too young to read that eye chart. So we
Wonderful.
go in and we visit in underserved communities, do that low vision screening and flag problems early for them.
Fantastic. Thanks for both being here. Important conversation.
Thank you very much.
Thank you.
And don't forget, you can find all of our resources and Women's Health Wednesday segments online. You can go to news10.com and look for Women's Health under the Community tab. We'll be right back.